The menopausal journey hits women when they are in their caregiving years, managing
Yes.
responsibility with family, with their jobs. So it's so difficult to find times for themselves, to dedicate to themselves. And sometimes it has that structural social guilty built in that I cannot stop for myself now. This is just part of getting older. This is just part of
Yeah.
menopause. I'm not going to look into this. But definitely, lifestyle changes are so important. Weight management is important for menopause and obstructive sleep apnea. And I want to emphasize that because of the changes in hormones, women are more likely to start having accumulation of visceral fat during menopause. That is usually around the waist. That is something caused by decreasing hormones and increases inflammation, increase the risk for cardiovascular health. So it is important for obstructive sleep apnea, but it's important for their health overall.
Welcome back to the Menopause Disruptor Podcast. This is the podcast where we challenge outdated narratives, unpack science that really matters, and give women the language and knowledge to advocate for their health with confidence. Today's health topic: sleep. We are going to tackle one of the most misunderstood and often dismissed aspects of the menopause transition. Our sleep is so vital. And if you've ever been told that poor sleep is just part of aging, or handed a prescription without anyone asking, why has your sleep changed? This conversation is for you. Shocking statistics: sleep apnea. While it is often thought as a condition that primarily men are affected by, the reality is 1 in 5 women will suffer from sleep apnea, and yet 90% of them are totally unaware. And this is a hidden health issue, and just one example of how women's sleep health has been overlooked. I'm joined today with Dr. Carleara Weiss. She has a PhD and Master's of Science in Nursing and a registered nurse. She's also a nationally recognized sleep scientist in the United States and Aeroflow Sleep's sleep science advisor. Dr. Weiss completed her PhD and postdoctoral fellowship in sleep and circadian rhythm research at the State University of New York, and she brings a rare combination of deep scientific expertise and real-world clinical experience. For 8 years, Dr. Weiss worked directly with adults and older patients in hospitals, nursing homes, hospices, and private practice, giving her a front row seat to how sleep disruptions shows up across the lifespan and how often women's concerns are overlooked or oversimplified. In this episode, we're unpacking what's really happening to sleep during perimenopause and menopause, why doctor-led evidence-based education is essential for women to receive proper care, and how to avoid the risk of self-guided medical decisions that can sometimes do more harm than good. We'll also get into practical science-backed sleep strategies that actually work for midlife women, and how understanding your circadian rhythm can be a powerful act of self-advocacy. So whether you're waking up at 3 a.m., feeling totally dismissed by your doctor, or simply want to understand your sleep through a smarter, more compassionate lens, you're exactly in the right place. Please join me in welcoming Dr. Weiss to the Menopause Disruptor Podcast. Welcome, Dr. Weiss, to the Menopause Disruptor Podcast, talking about sleep today. Such an important topic.
Thanks for having me, Mary. I'm so excited about talking to you about sleep and menopause, a very important part of the menopausal journey. So I'm excited to talk to you today.
I always like to ask my guests their backstory. Can you tell us what drew you into sleep science and in particular circadian rhythm research, and why it's so important in the menopausal transition?
Yeah, so I started my career. I'm originally from Brazil, so you're definitely gonna notice my accent, even though I've been here for almost 15
Yeah.
years now. So working as a geriatric specialist in Brazil, and also
Mhm.
my personal experience as being a family caregiver, when I noticed that sleep disturbances, any problems associated with sleep, are such an important part of aging and how to achieve a healthy aging. So,
Yes.
for example, my great grandmother, my grandmother, they both had dementia, and they had a lifetime of untreated obstructive sleep apnea, which is a problem that causes stopping in breathing and stopping oxygen levels in the brain multiple times during the night.
Wow.
And most people only recognize or think about obstructive sleep apnea as snoring at night. And it's so much more complicated and more complex than simply snoring, right? So lacking oxygen in the brain multiple times at night for many years of their lives. And now with the research, we know that sleep has this important component in maintaining brain health and clearing up the multiple biomarkers and proteins that are accumulating in the brain that
Ah.
leads to dementia, right? So the fact that they had a sleep disturbances that was probably dismissed as just being part of getting older or being a woman and gaining a little weight, part of menopause, it was dismissed and wasn't treated. And as I said, they ended up having dementia. So that really draw my interest as a geriatric specialist in look more into sleep and circadian rhythms, how our biology rhythms are affected by the transition to getting older and how we can use sleep as a tool to sleep better, but also to age well.
So before we get into understanding how to improve sleep and some of the strategies, what percentage are we seeing in the menopause transition with women experiencing sleep apnea?
That's such an interesting question because right now we are having more research into this. So we have very limited large epidemiological studies that will give you an overview about this at this point. So um, as many other things that happens to women, this topic has not been so well explored in science. I've seen a shift in the past 2 or 3 years to have more information on this. But from the studies that we have right now, about 50%, anywhere from 50 to 70% of the women in the perimenopausal transition into menopausal and postmenopausal, they report sleep difficulties, and obstructive sleep apnea is one of those difficulties. And also, because of the overall changes caused by menopause with estrogen and progesterone levels, how obstructive sleep apnea manifests to this woman is different than the traditional clinical presentation that you see as, for example, snoring. Not all women that have undiagnosed obstructive sleep apnea will snore at night, right? They most likely will have daytime symptoms and daytime complaints, and they will complain about insomnia, not.
Ah.
Yes. So that's where the research is really diving into now, that they will not complain about, I woke up because I was snoring, or my husband or my partner told me that I was snoring. They will simply lay awake for many times during the night, or they wake up multiple times during the night. And the next day they'll have that brain fog, difficulty concentration, irritability, fatigue, just overall exhausted. And if they're going to a clinician that is not really in tune with the newer assessments, they're probably going to say, you have insomnia, here's a pill for insomnia, and they take that, but it's not treating the obstructive sleep apnea.
Before we dive back into today's episode, I want to share something really special with you. An ongoing sponsor is Hen's Den Yoga, a beautiful home studio located in the Comox Valley, owned and operated by Sarah Ham, who you may have heard on a recent podcast educating us about the importance of mammograms and breast health. Sarah has created a welcoming, supportive space for all students to reconnect with their bodies, calm their nervous system, and build strength from the inside out through intelligent, thoughtful yoga, Pilates, barre, and HIIT classes. Book a class at hensdenyoga.ca. And if you're a values-aligned business and want your work shared with this community, you too can become a sponsor. Check out Sponsor the Show in the show notes below. Yes. So again, women's bodies were never properly researched in science, and as a result, it presents differently. The medical system is just trying to tell us, oh, that is just part of the change. This is just part of the experiences you're going to have. So then how can a woman distinguish if she's complaining about severe insomnia or just insomnia in general? How can she distinguish between whether this is on the cusp of sleep apnea, it's full on sleep apnea, or just simply because she has disruption to her circadian rhythm, higher levels in cortisol, for example, the wired but tired brain where you can't just shut it off. So what are some of the key signs to women should start paying attention to?
So that's a very important question. Again, from the research standpoint, we have some situations that the women in this phase of their lives, they will have insomnia and then they will have a treatment for insomnia and they feel better after they have this insomnia treated, right? So one of the signs that they should have for the evaluation is I'm already taking some support, take some medicine that supports my insomnia, and I'm still exhausted. I'm still
Right.
having time fatigue. It's a persistent symptom, and I'm still waking up in the middle of the night multiple times. So if they're still waking up multiple times, it's not insomnia related problem if they are already taking a treatment for insomnia, right? It's likely that their brain is waking them up to breathe more or to breathe better.
Oh,
This is a sign to look for a sleep specialist, ask for a sleep study that no, nowadays those can be done at home too. So most insurance will cover sleep studies at home now. So ask for a sleep study. Say, I've been taking medication for insomnia or been taking supplements that support my sleep to reduce insomnia, and I'm still waking up multiple times at night and feeling fatigued the next day.
interesting. Okay. So at-home sleep study, it gives them complete autonomy and in control, get the answers quickly. After she presents sleep apnea, she's done her at-home studies. What next? Go to the doctor and present what her findings. What's the first thing that she should be doing to tackle this right away?
Yeah, so if they complete the sleep study, they have the report, the physician is going to evaluate that report and come up with a treatment for obstructive sleep apnea that most likely is CPAP, right? CPAP is the gold standard that we have for treating obstructive sleep apnea. It's a positive air pressure, so the air is going to come in and helps maintain the airways open while they are breathing at night. So ideally, they need to have a follow-up and support to use the right CPAP, the right amount of time, and making sure that they are adjusting well. And I can explain a little bit about that. So for the insurance, at least 4 hours a night of use of a CPAP. So
Okay.
at least 4 hours of use of CPAP overnight is what the insurance is going to look as compliance. And when they go to the physician is going to look at that as compliance as well. So at least 4 hours overnight using their CPAP. The second thing is that making sure that they have the best and more comfortable mask that is appropriate for their CPAP titration for the pressure that they're going to use for the airway pressure. Sometimes it can be a full mask, sometimes can be just a nose one. So a full mask covers the nose and the mouth, and the other ones can be just the ones in the nose. So depends on the physician evaluation as well to determine which one is going to be best for them. And also we have so many options now of additional gear that they can use, like something to make more comfortable in their face or in the head, or if it goes around their ears. There's so many options that we can provide for them to make sure that is a comfortable experience. Those are the key things once they receive a diagnosis of obstructive sleep apnea, and they want to have the best supplies and the best support to be adhering to the treatment.
Now, oftentimes women are reluctant to seek any treatment because it may not be covered under insurance. And because the medical system has never made a solid connection in the past between hormonal health, hormonal fluctuations, menopause, and sleep apnea, women are just not tuned in to this being a problem. So, of course, it comes with education, having you on a podcast for example. But insurance is now saying, or insurance that maybe has always been there to support all the equipment, like the CPAP equipment, for example, the testing to allow women to take a positive stance, proceed with treatments, proceed with testing. Is that right?
That's right. And I'd say that a positive shift on that to make more accessible, and even with the home studies, for example, it's been the past 5 years to have more flexibility and be more accommodating for all patients, but it's really benefiting women, right? That having the studies done at home, for example, having more flexibility with different types of masks that can be used that are more flexible and fits better for a female body than for a male body. So those changes, as I said, in the past 5 years or so, they are being more positive for women. But
Yeah.
the problem, I would say, is that the information about those changes is not there. So if you don't know about it, you're not going to advocate for yourself about receiving the best care and also
Yeah.
to have this flexibility available for you.
Yeah. And again, it's only been the last 5 years. So the question is, how quickly has our medical system caught up with what little research has come out in the last 5 years? And is this even something that's even making it into mainstream? Exactly. So we have voices like you to help us share this information. Is there any lifestyle adjustments that a woman can do either to prevent or at least diminish the possibility of sleep apnea? Or if she has sleep apnea, sleep problems, can she integrate lifestyle changes that can help?
Yes, absolutely. That's an important question as well, because as we were talking in the beginning, this transition through the menopausal journey hits women when they are in their caregiving years, managing
Yes.
responsibility with family, with their jobs. So it's so difficult to find times for themselves, to dedicate to themselves. And sometimes it has that structural social guilty built in that I cannot stop for myself now. This is just part of getting older. This is just part of
Yeah.
menopause. I'm not going to look into this. But definitely, lifestyle changes are so important. Weight management is important for menopause and obstructive sleep apnea. And I want to emphasize that because of the changes in hormones, women are more likely to start having accumulation of visceral fat during menopause. And that is usually around the waist. So that is something caused by decreasing hormones and increases inflammation, increase the risk for cardiovascular health. So it is important for obstructive sleep apnea, but it's important for their health overall. So this weight management, having try to build more muscle, right? So having exercise to build muscle, have attention to their diet. Those
Yes.
things are so important for obstructive sleep apnea, but also for their health in overall in this menopausal transition.
Yes, absolutely. And in terms of diet, you spoke about this earlier that sleep apnea and just sleep problems just in general are have significant health risks if it's not taken seriously. And I have said this before, I've had other guests say this before, that if there was a panacea for menopause symptom management, it would be sleep. If you don't have good control of your sleep, this is a critical health issue. You named dementia as being one potential because the brain isn't flushing out the proteins, if I understand, which it
Yeah.
does in the rest digest state when it's at sleep. Let's talk about what other key health markers we should be thinking about in terms of, because the big three are heart, brain, and bone. So
Yes.
the impact of poor sleep, sleep disturbances, insomnia, or even being deprived altogether of sleep. What's happening in the body?
Yeah, so I'll take just a quick step back to
Okay.
clarify what sleep does for those things, and then we can understand better when we're not sleeping well, what the problem is.
I like that. If you understand what why it's
Yeah.
necessary. You're more apt to have the buy-in to do something about it. Yes.
Yes, exactly. I really like to do this when I go out in the community to do lectures about healthy aging and brain health and all this. And I like to start always talking what sleep does, right? So sleep is the restorative way that our body has to stay functional and to stay healthy. So all systems in our body, in our cells in our body, responds to a biological clock that we have in the brain. And this biological clock sets the timing for everything. So from the time that we wake up until in one day and then the next 24 hours, our biological clock is setting the stage for every function that we have in our body. And that includes cell division, immune system, metabolism, strength, thinking, mood, everything, hormone regulation, everything is associated with sleep in the biological rhythms or the circadian rhythms that we have in our brain. So if you're sleeping well, your immune function is regulated, your digestive system is working better, you have the ability to regulate your hormones better, you can recover physically better, you can recover for your brain function better, right? So all these physiological systems are affected by sleep. So the moment that you stop sleeping the recommended hours or having a reduced quality of your sleep, then all those symptoms are going to feel that something is missing because they don't have the enough time to recover. One typical example is that somebody that has a deadline at work and then is pulling in late nights of work or even all nights. As soon as they submit that deadline, they get sick. They get a cold. They
Yeah.
have like a neck spasm. They start feeling something, right? Because over the course of those days of not sleeping well, they did not have enough time for the physical and mental recovery. So they
Yes.
yeah. So then when you start noticing those things, this type of connections, is very clear that sleep is the the one powerful tool that we have to maintain our bodies healthy. So another example that I like to give is hunger and appetite regulation. So we have two hormones that are deeply regulated by sleep. There are leptin and ghrelin. So
Yes.
they tell us when it's time to eat and when it's time to stop eating. So it tells when your body is satisfied, right? So if you're not sleeping well, those hormones become dysregulated. So
Yes.
what we see in the research is that people who have sleep deprivation, either by a couple hours or long-term sleep deprivation, such as night shift workers that are constantly doing nights, spend the night awake, right, for work. In those situations, they feel more hungry, they feel less satisfied, and they're craving more high processed food, high fat food. So as a consequence, you say you talk to a woman that start working as a night shift nurse and say, "Oh, I gained 10 pounds in my first year because I was doing night shift." Yes, because your hormones are dysregulated. It is affecting their overall health and say, "Oh, I become pre-diabetic after I start doing the night shift." Yes, because your hormones are dysregulated. You're craving more food, you're craving more processed food, fat food, and then you become more inflamed. If they are perimenopausal, they have their accumulation of visceral fat that also increases inflammation, makes, even if they never had a family history of diabetes, they can become pre-diabetic or even develop diabetes because of not sleeping well.
Hence
So
the adage shift workers takes at least 5 to 10 years off your life. This is understandable.
yes,
Okay.
yes. So if you put this on top of being the menopausal journey, the hormone shifts in estrogen and progesterone, they affect how sleep works. So we are already feeling some physiological changes in our body that will impact sleep. So if we need to be very mindful about our lifestyle, our dietary choices, and also make an effort to stay active and find time for physical activity so we can fight those problems with better tools, right? And maintain proper sleep, even though we are going through different transitions in our life.
Right. Now, when you talked about the two hormones associated with appetite, ghrelin and leptin,
Yes.
is the reverse true? Poor sleep, sleep disruptions, can they actually do the reverse in which we lose appetite?
Well, so from those two hormones, it's unlikely that we're gonna lose the appetite because of the sleep deprivation. What may cause a sleep lack of appetite is chronic stress and sleep deprivation. We are talking about a different mechanism, right? So, aside from having the hormones being affected, if we have a strong mental health component associated with that, that can definitely impact appetite and decrease appetite.
This leads me to another area of questions, and not to identify anybody, but I did come across a case with a woman. We discussed her sleep, and she was quite concerned. Grossly sleep deprived, insomnia, not sleeping for a very long time, and rapid weight loss, which is very unusual. I too did some research to try to figure out if there was a causation or correlation. In this woman's case, the solution was to throw pharmaceuticals at it. Her doctor said, we'll just give you some sleeping pills. You'll be on it for a short period of time. That should fix everything. You'll get back to a good night's sleep. You'll get your appetite back in order, your weight back in order. What is the danger when our medical system recognizes sleep as just something to quickly fix with a pill?
Wow, that's really concerning because as we are just talking, how sleep is powerful and impacts many other systems in our body. So if we're only try to provide a pill to fix the sleep for a short time, or assuming that is gonna be only a localized solution, we are missing out the big picture
Of
because the sleep will
course.
be affecting the whole system. So it is unlikely that we're going to have a sleep problem that is isolated. So the
Yeah.
sleep problem is going to happen because we have a hormone that is affected, and that hormone is affecting the muscle structure for obstructive sleep apnea, for example, or is affecting the sleep architecture for insomnia, for example, or is affecting the thermoregulation. So we start having hot flashes, and that's affecting sleep. So
Aha.
sleep is not an isolated problem, and I would say, quite honestly, nothing in our bodies are isolated problems. We are systemic human beings. So one problem may be perceived as something small, but they are either a reflection of something bigger, or they are part of a bigger component that needs to be evaluated as a whole.
The bigger picture, as you said, because there could be something more going on metabolically, perhaps.
Yes, absolutely.
Yes. In this woman's case, interestingly enough, she did push to get some blood work. And the blood work came back showing that her neutrophils, which is the white blood cells in the body, were quite low. Now, again, I was wondering whether there was a correlation with sleep or a correlation with appetite, or one caused the other. But interesting, her white blood cell count was low, which could have been related to maybe other things. But it certainly drove home the point that there was more going on, because these neutrophils are produced in the bone marrow. Could we just sort of look at that holistically? If we're seeing drastic changes in, say, blood cell counts and all of the first line defense that a woman would have to fight off infection, disease, illness. So, how could we, and let me just phrase this in such a way, we see that by ignoring these subtle indications, like the sleep is telling us a story, the sleep architecture is telling us a story, and then other underlying health concerns, whether they're related or not, what could be happening, big picture, from either menopause or just metabolic health in general?
So About this specific case, there's so many things that could be happen. So I cannot give an explanation for that specific case. However, I would say for women that is experiencing this perimenopausal journey or already in the postmenopausal side,
Mhm.
if they are not feeling like themselves, they are having sleep problems, they are not feeling like themselves, that's enough to seek evaluation, right? And usually that's where we have problems finding help, because even when I talk to physicians that have been practicing for many years, because we know that the science and the healthcare system were not designed or organized in a way to be welcoming for women that having this type of complaints, that it's like, I don't feel like myself. I remember from my grandmother, for example, it's just, you're menopausal, you just wait it out and you're going to feel better in a couple of years. That used to be the response that women get. And I think up to this day, if you don't, you need to find a provider that is really prepared to take you in and do a thorough examination, including blood work, including sleep studies, including asking about your lifestyle, your diet, come up with a plan for exercise that is feasible for you. If you don't find a provider that is in tune with all this, I'm afraid that women will continue to be dismissed. So the more we talk about those small changes that can be happening at even 10 years before they get menopause,
Mhm.
it may not show in a blood work, for example. So if they are perimenopausal and they got a blood work, they will see the estrogen levels there, they will see progesterone levels there. But the women, will tell you, I don't feel like myself. I have brain fog. I'm annoyed. I'm irritated all the time. I don't have any patience with my husband and my family. I'm struggling to have attention and concentration at work.
Yeah.
At this point, might be important to look at small interventions with supplementing estrogen, for example, even though, as I said, like the blood work may say that they don't need hormone replacement therapy yet, but there's some new therapies emerging now that says, okay, we don't need to wait until she hits the extremely low levels to start treating them, right?
Yeah.
So I think that's where we should draw a line as women, say, okay, this provider here dismissed me, said that it's nothing, my blood works fine, but I'm not feeling okay. So I need to find a provider that is going to listen to this and is going to dig deeper into this. And we're going to find
Yes.
it together.
Yes. And oftentimes in this day and age, it's hard to find another provider. We're so limited. So this is where the point where the advocacy comes in and presenting your case. And I often say that one of the best ways that you can prove that I don't feel like myself anymore is to track symptoms. Everything, whether you're cycling or not, track everything, how you respond to food, how you respond to exercise. Did you even have the energy to even want to go out and exercise or move the body? Do you even have the desire to be amongst friends? How is your cognitive function? Like, track everything. This is your whole complete big picture. And very important to be able to advocate having that evidence in hand. But on just looking at the whole architecture of our sleep, as you spoke of, and when we need that deep sleep versus a REM sleep versus the light sleep, let's speak to the role of all those factors that could interfere with the sleep architecture: light exposure, meal timing, and then also nervous system regulation in supporting circadian rhythm.
Yeah, so we know that typically we transition from different sleep stages over the night, and they are all equally important for physical, mental, and cognitive recovery. So we start the night at light sleep and we progressively transition to deep sleep stages and REM sleep. We spend about 25% of the night in light sleep. Light sleep is very important for physical recovery. So all the things that we mentioned about muscle recovery, cell division, hormone regulation, muscle recovery, all those things happen during the light sleep stages. And then during slow wave sleep, which is a deep sleep stage and REM sleep, which also a deep sleep stage, those different phases of sleep, just so to speak, are important for cognitive recovery and also for mental health recovery. I say this because, for example, for women who track sleep with Fitbit or any other app to track sleep, they say, oh, I only had 25% of light sleep. You're right on point, right? We only need 25% of light sleep. Or
Oh,
I had, I don't know, 7 hours of sleep and 25% was light sleep. That's okay. That's exactly what you should be looking at. And then, as I said, the REM sleep and the slow wave sleep, they are important for cognitive function, for cleaning out the toxins that accumulate in the brain during the day, and also for mental health. There are more studies coming out about REM sleep, dreams, and memory consolidation that are important for mental health. So this is the normal sleep stage. As we go for the menopausal journey, we have changes in estrogen and also progesterone, but we start experiencing some change in the sleep architecture because then we have less REM sleep that is caused by the decline in hormones in the menopause. We also have more sleep fragmentation caused by the hormone change. So having more sleep fragmentation means that the women are likely to wake up more time, having less slow wave sleep and less REM sleep. That's associated with have more short-term memory impairment or forgetting things or having difficulty remember the names of things, right? So like they wake up in the day and like, forgot what they're gonna do, right? Have that lapse in the memory, which is so typical that women refer to us. So those things are physiological changes that happen in the brain for the menopause. And let's not forget hot flashes that is caused by also decreasing hormones, but affecting the thermoregulation, that center that we have in the brain. So now we have the system that is like the heater in our house, right? That is going off when it's not supposed to go off. It's typically during sleep that it goes off. So the heater is on and then it makes waking up more often. So those are symptoms that are physiological symptoms driven by hormones, but doesn't mean that you have to have those symptoms for the 10 years of your life before menopause and then for another 30 years after you hit menopause. There is
right.
treatment for that. We should be informed about treatments that can regulate our hormones so maintain our bodies functioning better as we age.
Yes. Even though it might be common, it doesn't mean we have to normalize it, nor should we, like we have been for years and years and years.
Exactly, because once again, those are symptoms in the sleep process, but they will affect the entire body over time. So not sleeping well and not having the proper clearance in the brain or not having a proper memory consolidation that it needs to happen in the brain is not something that is going to be a sleep problem. It's going to be an increased risk for dementia, right? So we
Yeah,
need to treat those things. We need to take charge to advocate, say, I cannot just accept that I'm going to have 10 years of sleep problems and then after that I'm going to have dementia. That's not acceptable. We need to
that's
advocate
not
for something
not
better.
acceptable. And of course, it starts with education and awareness. I agree. So it doesn't come down to just the quantity of sleep we have, and you gave an example. A woman might get 7 to 10, but it's broken up in chunks that over the course of the night, she may have got her 7, but it was fragmented. Like you said, a chunk here, a chunk here. There was a disruption in between her slow wave or disruption in her REM that pulled her out of the sleep. So it really comes down to the quality of that sleep.
Yes, and this is something that I see frequently through the sleep studies and for the overall studies that I run, that what brings women in is saying that aside from not having a long duration for sleep, is that I don't have a good sleep quality. I don't feel refreshed when I wake up in the morning. I feel like I need to lay in bed for 10 hours to, if I'm lucky, I'm going to have 5 out of 10 hours. So now they
Mm-hmm.
start having an anxiety, worrying about, oh my gosh, it's almost bedtime and I know that I'm going to lay there awake for 5 hours. Like I don't want to do that again, but it's so
Mm-hmm.
normalized that it's like, oh yeah, this is what it is. But there are options. So it's really
Mm-hmm.
important to have this conversation to say that there are options, there are treatment options that can help.
What about exposure to blue light? We hear a lot in the media now that shut off your devices a couple hours before bed, reduce your screen time, even TVs and computers. How accurate is this advice we're hearing?
So this advice comes from the circadian biology, right? Light exposure has a direct impact on melatonin production in the brain. So we have cells in our retina that communicate directly with the brain to tell the brain to produce melatonin or to shut down melatonin. So melatonin is the hormone that tells our body that it's time to fall asleep. So if we have melatonin, stable melatonin production, and the better yet is that we have a schedule that we do that every day at the same time, like going to bed the same day every time, and then waking up the next morning every day at the same time. That's really helpful for a biological clock. So there's a device to avoid light comes from this, that light shuts down melatonin production because it tells the brain that they still they need to stay awake or alert for longer because it's still daytime outside. So it really comes from
Mm,
the biological aspect for a circadian rhythm. So it is an important advice to avoid light. And I typically say at least 1 hour before you're going to bed. But then something that we don't talk enough is that what you're gonna do in this 1 hour before you go to
I
bed,
was just
right?
about to ask. Yeah.
Yeah. So like, oh, don't no TV, no phone, no iPads, nothing electronic devices this 1 hour before you're going to bed. So what are you gonna do? Just gonna sit around being anxious? No, you try to fill out that 1 hour with your bedtime routine and looking for things that are promoting relaxation because our brain is going to work as a computer. So if you have multiple tabs open in your computer, if you can close down the computer, but it's draining the energy. So it's draining the power of your computer. So we wake up the next morning, well, my battery life is only 20%, but I wasn't using my computer all night. Yeah, but you have all those tabs open, draining the energy. So you have to do the same thing for your brain. So that 1 hour that you avoiding light exposure for a natural production of melatonin in your brain, try to use that 1 hour to other things that help your body understand that sleep is approaching. So things that I recommend for this time, as I said, close all those tabs. So for me, for example, I know what my schedule is gonna look like the next day, and I have family, I have a toddler, so I have used that time to start organizing things for the next day, so my brain doesn't have to think about those things when I go to bed.
Smart.
It's everything is there, is organized. I don't have to worry about it. And it can be as simple as I have the outfit for tomorrow ready. So I don't have to think, oh, it's just knowing what I'm going to wear, what my daughter's going to wear. It's there. Took that out of my brain, right? Reading is something that really helps me. So I'm going to read something. I'm going to read a book for my daughter, or my husband is going to read a book for my daughter, and I'm going to take 10 minutes break because I need that 10 minutes to myself. And I'm going to do my yoga on that 10 minutes.
Of course.
Right.
Yeah. Yeah.
So we do this in a warm shower. And I understand that during the summer, that's more challenging. So I say you take the shower in the temperature that you like, but before you finish your shower, increase the water temperature. Have that warm shower because it helps regulating the temperature. Our temperature needs to decrease so we can fall asleep and stay asleep. So if your body temperature is too high, you're going to have a hard time falling asleep and staying asleep. And that's why hot flashes also impact our sleep,
Of
right?
course.
So try to have the warm shower, which seems counterproductive. Like, oh, I'm having a hot flash and I'll take a warm shower. Yes, you're gonna do the counterintuitive thing because that's gonna help lower the body temperature.
Okay. It's a stimulus to the hypothalamus to say, no, 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 you've got heat coming in. You can turn off your internal thermostat.
Exactly.
Oh,
So we need to use that hour wisely. And the other thing that I say is that because you're doing a behavioral change that has physiological consequences, it's not like taking a pill for sleep, for example, right? If you take a pill, it's gonna work in 30 minutes, it's gonna knock you out. You're doing a physiological change with behavioral change. Those things take a longer to start noticing the effect. But once you notice the effect, you're not gonna want to do anything else. You want to
yeah.
continue with your routine.
And it gives you that sense of agency all over again, like we said earlier on. So I got to control the it, the behavior. I got to control the outcome.
Yes. This is something
Yeah.
that when I talk to people, that's the things that I recommend the most, right?
Mm.
You understand the physiology and you understand why the behavior is changed the physiology. So now you're going to stick to it because you know the outcome, you know the consequences, you know the benefits for your health. So now, yeah, I can do this. And it's not something easy to do, but it's rewarding and physically and mentally rewarding as well.
That's amazing. I really like the analogy about all the tabs being open on the computer. That's essentially what we're doing with our brain when we don't give it that time to close all the windows.
Yes, yes. And it drains the energy, it drains the battery life. So we are doing this to ourselves without noticing. But now that we know, we can start making changes.
Right. So, how are you getting in front of the medical community to educate them on proper sleep hygiene and recognizing that sleep apnea is a real thing for menopausal women?
I've been very fortunate, I would say, that I've encountered people who are opening to listen to those problems and
Mhm.
to understand that we need to do more research, but also we need to listen to the women more. As I said, I've been fortunate to pair with companies, community centers, and even have a role in publishing my articles and publishing my research and having this information being presented out there and seeing more and more people become interested. And I would say to you that as much support that I'm seeing from the research community, I'm seeing support from the women that are out there living their lives and noticing that those things are important for them. So it's a
Absolutely.
synergy. It's really a synergy. So I've been doing
Yeah.
this. So I graduated 20 years ago. And I feel, as I said, in the past 5 years, it's been the most open I've ever seen for listening
Great.
to the people and to be open to listen to the research that we do and making changes.
That is wonderful. Yeah, I'm just taking a quick peek at the Aeroflow Sleep website, and I see there's a whole entire section in the resource section, and we'll get that link in the show description of the importance of women's sleep hygiene. Just a plethora of resources as to why addressing women's sleep health matters, videos, other educational resources. This is one of the under evaluated, under appreciated, as you said earlier, areas in a woman's health, particularly in the menopausal years, that is screaming for attention. And it's
Yes.
finally getting the
Finally
attention it
getting
deserves. Yes.
finally getting it. So I'm very, very, as I said, I'm very happy with the synergy that we have right now. That's this area. It's finally receiving the attention it deserved and also having the positive benefits for the women
Yeah.
that definitely deserves that.
Yeah. Yes, that's so good. So looking ahead, what excites you most then as you've seen the yardstick move in the last 5 years? What is exciting you most about the future of sleep science, particularly, of course, with women and menopause?
That's, I would say, it's a sensitive question in a way that, as I said, I started on this because of my grandmother, being a clinician, being a geriatric provider, and I said, "Oh, I want to do more research." So I went
Good
through
for
the
you.
research pathway because of my grandmother, seeing how much she struggled. And I don't want my mom to have the same struggles. I don't want the same struggles to myself. And I certainly think that when my daughter becomes an adult woman, she has all the resources available for her. So that's what motivates me the most. And I feel that the research that I do, I have colleagues in multiple
Yeah,
universities in the United States and across other countries too.
wonderful.
We are getting to some powerful recommendations about dietary changes, dietary supplementation, and also ways to evaluate women in a very specific way to be mindful about their transition for the menopause and understand that the clinical presentation that we have for men and for women are different, and we need to be assertive
Yeah,
about looking at
right.
women with the respect that they need. So this is what I see for the future, that we're gonna be making change that will become standard for every practice, for every research. So right now, as we said at the beginning, you need to be lucky to find one provider that received the education and has the knowledge to
Yeah,
address women's complaints or concerns in a specific way. But I feel like the more we progress with this research and with the resource that we have, this is going to become a norm that now
that's, yeah,
when women
yeah,
walk the door, okay, you are perimenopausal, this is how we're going to approach you. It's not
yeah.
going to be something that the woman needs to fight for it and have so much stress associated with it.
Exactly. Quoted by famous Dr. Stacy Sims, we are not small men. Yeah, we're
Yes.
presented so many different ways. The outcomes might be the same in terms of health factors with the brain health and dementia and heart health, but the mechanisms by which we treat it or how they present have to be taken into consideration to find the right solutions. This has been amazing. I always like to finish with this new thing we're doing now.
Mhm.
And we're going to do that rapid fire. It's a little thing that I stole from Brene Brown. I don't know if I have the rights to do it. So, very quick questions. It's
Mhm.
fun, but it's also very insightful to pull out
Okay.
anything we may not have gotten from you yet, Dr. Weiss.
Mhm.
Um, all right. I'm sure this is an obvious answer. Morning person or a night owl?
Morning person now, but I was a night owl before having kids.
True. One sleep myth you'd love to retire forever.
That we can sleep when we die. We need to sleep now, or we're gonna die sooner.
Good one. Most underrated sleep habit.
Going to bed at the same time every day.
Yes.
That really sets the stage for the biological clock, and all the hormone regulations gonna go from there. So that's really underrated.
Consistency, consistency, consistency. Yes. One thing you wish every doctor understood about menopause and sleep. I think we touched on this one several times.
But if I can narrow down to one thing, is that listen to the woman. That we can have a textbook of how every symptom needs to present, but for them is different, and for them needs to be evaluated in a different way.
Love that. Yes. One of the biggest mistakes women make when trying to fix their sleep.
Wow, that's a tough one, but I would say one of the biggest mistake is just lying awake in bed for hours. So if they cannot fall back asleep, get out of the bed, try to do something that relaxes them, either physically or mentally relaxation, and then try to come back to bed again. If you stay in bed awake for 2 hours, we're creating a negative enforcement to the brain that the bed is you are supposed to stay awake in bed, and then it's going to be a much bigger problem to come back from that.
So train the brain. If you're not sleeping, get the
Get
heck
out of bed.
out.
Yeah.
Smart. I like that. Best sleep supporting habit that costs nothing.
Best sleeping habits cost nothing. Hmm. Wake up at the same time every day. I would say this. So
Hey.
pair the bedtime with the wake up time. So now you have your biological clock on a schedule, and then all your hormones are going to be regulated from there.
Yes, even no matter how tired you might be, just make sure you don't hit snooze.
Yeah.
Guilty. Coffee, friend, foe, or it depends.
It depends. So it can be a friend if you take one cup of coffee at least 1 hour after you got up in the morning. Not like you have your breakfast. Your breakfast cannot be your coffee, right? Have breakfast, have protein, fiber,
Yes.
then you have your coffee. So
Yeah.
in that case, is a friend. If you have your coffee after 3 p.m. on an empty stomach, then you're against yourself.
You're tested for being awake. Yes.
Okay.
Very last one coming up. If sleep were prescribed like medicine, what would be the best dosage?
If it was prescribed like medicine, 8 hours a night of sleep, that would be the best dose.
Awesome. This has been such a great conversation, just full of really smart advice, but not only just that, the reason behind it, the why. This has been amazing conversation. Dr. Weiss, where can people find you?
On my website, that is carlearaweiss.com. Also, Aeroflow Sleep has resources for sleep education, so you can find me there. And we are on social media also sharing sleep educational components there in a way that everybody can understand and very easy to apply to their lives.
So beautiful. Knowledge is power. We'll get all those links in the show description below. Thank you so much for giving your time, your energy, and your expertise on our show.
Thank you so much, Mary. It was a pleasure talking to you today.
Sleep. Let's never underestimate our sleep. It's not just about quantity, it's the quality. So if you're suffering from insomnia and fragmented sleep, you might get 6 or 7 hours in chunks. But if you're disrupting slow wave sleep phase and REM sleep, you're not doing yourself any good. Get it checked. Don't let a doctor push back. Like the story that I shared. I kid you not, that is a true story. This woman was totally dismissed, told that her sleep problems would disappear with a pill, but never addressed the underlying issues related to the weight loss. Red flags, red flags, red flags. I'm so enraged by that. I actually could probably do a follow-on episode on that alone. But let's not keep pointing fingers at the medical system, because there are some great medical practitioners, nursing practitioners who are doing some really amazing work, educating others, getting in front of the problem with education, offering resources and tools, be it blogs, live events, speaking engagements. And Dr. Carleara Weiss is doing just that. And that is probably my biggest takeaway from this conversation, is that we are on the precipice of change. Just in the last 5 years, she has seen advancement in sleep science and scientific research related to sleep in all of her 20 years in practice. The pendulum is swinging, and this is a good thing. But let's get more voices rallying behind it so that we can keep pushing the yardstick towards better health, particularly hormonal health that is still severely underlooked and oversimplified. Another big takeaway for me from this episode was that 1 hour period, that golden period before you go to bed. If we can shut off our devices, our laptops, the television, and take that hour of being really mindful, whether we have kids at home, spending time with them or preparing them for bed or preparing ourselves for our next day, take that hour, prepare your stuff, do some self-care, have a warm bath or warm shower, a good book, a cup of tea, or sitting down and talking with your partner, your spouse, your children. My favorite thing to do, meditation and breath work. Another big takeaway, as I said in my intro, 1 out of 5 women are suffering sleep apnea, and yet it goes undiagnosed, unnoticed. We just take it for granted that, hey, if I'm not snoring like my husband is, I can't possibly be having sleep problems. But as the good doctor told us, it shows up differently in women. The fact that we are not getting quality sleep or being aroused in the middle of the night, either jolted awake from a panic attack, some anxiety, because our temperature has changed due to the hypothalamus getting different signals as estrogen leaves the body. These are all disruptors to our sleep. But other things that might be keeping us awake and disturbing our sleep or even depriving us of sleep for a long time are leading to bigger health concerns. The big one mentioned in this podcast, brain health, and poor sleep being a precursor to both diabetes and dementia, because we're not giving the body that quality time to do all of its clearing house, clearing out the brain of excess waste, for example, poor eating habits, because we are so wired and tired and the body just wants fuel and the brain wants glucose. Take a good look at your habits, your sleep habits, your eating habits. They might be linked. Chances are there's a bigger health story behind it. March into your doctor's office, armed with the evidence, which is your symptoms, and ask for the help that you need so this isn't overlooked. Advocate, advocate, advocate. And if you have a great doctor who's on your side and listening to you, thank them. Thank them for being so supportive. And then ask them, can you go off and tell a few colleagues of yours to do the same? Maybe that ripple effect will start changing the landscape in women's health. To find more about Dr. Weiss, you can find her on her website at carlearaweiss.com. That's spelled CarlearaWeiss.com. The link will be in the show notes. And visit Aeroflow Sleep at aeroflowsleep.com. And Aeroflow Sleep leave you with a gift. The results of their Wake Up Call survey. This survey reveals a growing gap in sleep health education and the rise of do-it-yourself sleep trends. What is do-it-yourself sleep trends? Well, that is people taking their sleep solutions into their own hands, which is doing more harm than good, sometimes without even realizing it. So it's important that we understand the facts behind these trends so that we can improve our sleep properly. Have a read of that survey. It's linked at shop.aeroflowsleep.com/wake up call. And I will have that link in the show description below. Until next time, keep disturbing the conversations around healthcare. Stay informed, stay educated, and stay wise. If today's insights resonated with you, I'd love for you to be a part of our growing community of menopause disruptors. Hit that subscribe button wherever you're listening right now. And if you know someone who can benefit from these conversations, please share this episode. Sometimes a simple act of sharing can be the first step in someone's healing journey. And hey, if you're ready to take the next step in your menopause journey, I'm here to support you. You can find all my services, including my comprehensive menopause intelligence digital course, one-on-one coaching programs, and workplace education services at mlcoaching.com. It's in the show notes. Want to stay connected and get regular doses of menopause wisdom? Follow me on Instagram at Menopause Disruptor Podcast, where I share tips, insights, and real conversations about navigating this transformative phase of life. Let's continue to disrupt this menopause conversation together. Remember, midlife should be the best life, and it will be. Namaste.